Hypertension or high blood pressure is the disease when the pressure in our blood vessels is constantly too high. Even though most people with this condition do not feel any symptoms, hypertension is a real disease with serious real consequences if not treated adequately, even death. That is why it is also known as the silent killer. But that doesn't mean people with some signs and symptoms can't have hypertension at all. Hi Healthy Buddies, I'm Dr. Tirta Wijaya. Welcome to my channel where we will talk about various health topics. And today we will talk about signs and symptoms of hypertension. Before we begin, let me explain some basic concepts about hypertension so you will understand what we are talking about in this video. High blood pressure is the condition where the blood pressure in our body is higher than normal. But not all high blood pressure is a disease. Generally speaking, high blood pressure is not a disease if it is temporary, because many different things can raise our blood pressure throughout the day as part of normal physiology. For example, when we are facing dangerous situation, our body is going into fight or flight mode. Our heart is pumping faster, our blood pressure is higher. This is normal. There is also a condition called white coat syndrome, where someone's blood pressure is high in doctor's office but remain normal in a relaxed home environment. This is not a disease either. There are several different diagnostic criteria for hypertension, but it is typically diagnosed when the average blood pressure is constantly high on two or more distinct occasions. Next, we will need to know how high is high blood pressure. Blood pressure is written as two numbers. The first number is the systolic number, represents the pressure in blood vessels when the heart contracts or beats. The second number, the diastolic number, represents the pressure in the vessels when our heart rests between the beats. According to the World Health Organization, hypertension is diagnosed if, when it is measured on 2 different days, the systolic blood pressure readings on both days are equal to or greater than 140 millimeter mercury, and or the diastolic blood pressure readings on both days are equal to or greater than 90 millimeter mercury. American Heart Association, however, has slightly lower threshold, where stage 1 hypertension is diagnosed as 130 to 139 millimeter mercury systolic or 80 to 89 millimeter mercury diastolic, and stage 2 hypertension as higher than or equal to 140 millimeter mercury systolic or 90 millimeter mercury or higher diastolic. There are other diagnostic criteria too. These diagnostic criteria are evaluated every now and then and updated according to the current population condition. So don't be alarmed if you see different numbers for hypertension diagnosis. You may ask, then what about 135 over 85 blood pressure? Is it hypertension? Well, the answer depends on your population and personal condition. To answer this question, kindly visit your local doctor and get proper examination. Now that we have covered the basics, let's talk about the signs and symptoms of hypertension. Most people with hypertension don't feel any symptoms. It is known as the silent killer because it can kill without any signs and symptoms. That is why visiting your local doctor and checking your blood pressure even though you feel nothing's wrong is the best way to know whether you have hypertension or not. People with very high blood pressure, usually 180 over 120 or higher, can experience symptoms including severe headaches, chest pain, dizziness, difficulty breathing, nausea, vomiting, blurred vision or other vision changes, anxiety, confusion, buzzing in the ears, nosebleed, abnormal heart rhythm or arrhythmia, and many others. Hypertension headache. often described as strong, throbbing pain on both sides of the head. It lasts for hours or even days, getting worse as time goes by. This usually happens when the blood pressure is too high that the blood vessels in your brain may have trouble adjusting. It can lead to irritation and swelling, which may cause a severe headache. The chest pain happens when the high blood pressure affects the blood vessels in your heart. It feels like heartburn to some people, but triggered by physical activities or emotion instead of food. Likewise, the other symptoms happen when the blood vessels on other parts of the body are affected by the high blood pressure. Hypertension higher than 180 over 120 millimeter mercury without any symptoms need to be treated urgently. But the one with symptoms of organ damage is a true medical emergency. If you are experiencing any of these symptoms and a high blood pressure, please go to the nearest emergency care immediately to prevent irreversible organ damage or death. It is better to be safe than sorry. It is better for you to get yourself checked and turns out to be nothing rather than you take it as nothing but turns out to be dangerous. The only way to detect hypertension is to have a health professional measure blood pressure. The procedure is non-invasive, quick, and painless. Although individuals can measure their own blood pressure using automated devices, an evaluation by a health professional is important for assessment of risk and associated conditions. Modifiable risk factors for hypertension include unhealthy diets like eating salty food, diet high in saturated fat and trans fat, low intake of fruits and vegetables. Then sedentary lifestyle, smoking, drinking alcohol, and being overweight or obese. In addition, there are environmental risk factors for hypertension and associated diseases, where air pollution is the most significant. Non-modifiable risk factors for hypertension include a family history of hypertension, age over 65 years, and coexisting diseases such as diabetes or kidney disease. Avoiding these risk factors can help to lower our blood pressure. Of course, there is nothing much we can do about the non-modifiable ones, but we can always change our lifestyle towards the healthier one that can help lower high blood pressure. This includes eating a healthy, low-salt diet, low saturated fat or trans fat with more fruits and vegetables, and being more physically active, which can include walking, running, swimming, dancing, or activities that build strength like weightlifting. Then try to get at least 150 minutes per week of moderate intensity aerobic activity or 75 minutes per week of vigorous aerobic activity. Then we need to do strength building exercises 2 or more days each week. Lose weight if you are overweight or obese. Then stop smoking if you are smoking and avoid alcohol and etc. Your recommended blood pressure goal may differ from other person. It depends on what other health condition you have. Blood pressure goal is less than 130 over 80, especially if you have cardiovascular disease like heart disease or stroke, diabetes, that is the high blood sugar. I have other video about this, and chronic kidney disease, and high risk for cardiovascular disease. For persistent hypertension that do not respond to lifestyle change alone, your doctor may recommend 1 or more medicines to help lower your blood pressure. There are several common blood pressure medicines. ACE inhibitors, including enalapril and lisinopril, relax blood vessels and prevent kidney damage. Angiotensin II receptor blockers, including losartan and elmisartan, relax blood vessels and prevent kidney damage too. Calcium channel blockers, including amlodipine and felodipine, relax blood vessels. Diuretics, including hydrochlorothiazide and chlorthalidone, eliminate extra water from our body to lower blood pressure. If you are prescribed this medicine, please take those medicine as prescribed by your doctor and keep appointments with the doctor on top of the healthy lifestyle. If you don't have high blood pressure, you can prevent it. You can lower the risk of hypertension by reducing and managing stress, the emotional stress, by checking your blood pressure regularly, even though you don't feel anything. Then, treating the high blood pressure and managing other medical conditions, then reducing exposure to air pollution. What will happen if hypertension is uncontrolled? Other than serious damage to the heart and the brain, there are many other complications caused by uncontrolled hypertension. But that is for another video. If you'd like to receive this kind of health information, you can subscribe to this channel. That is my sharing for today about signs and symptoms of hypertension. I hope you found this information helpful and can be a blessing. If you have any health-related question or topic you want me to cover in my future videos, kindly type in the comment below. But please do not consult your medical issues here. It must be done personally with your doctor. This is my disclaimer. See you in the next video. Stay healthy and happy.